good evening, everyone. We're absolutely delighted to welcome you here to our webinar this evening, Mental Health and Modulators, the Paediatric Perspective. I'm absolutely delighted to say that we're joined by Dr. Sarah Carroll, and also shortly, imminently, we will have Professor Paul McNally joining us as well. So before we go through the introductions or I hand you over to Dr. Sarah Carroll, and we will just go through, I suppose, a little bit of housekeeping rules. We're delighted to say, I suppose, this came about really from the meet and greet sessions that would have been carried out throughout the country by both Bernie and Zara. So really, this is the origin of this session. So we've lots of questions that have been submitted to us prior to the event, and also hopefully throughout the session, we'll be able to take some live questions through the Q&A box there down at the bottom of the screen. Just to let you know that the session is being recorded, so that's a great opportunity to really be able to watch back on the session, and this will be available within the next few days up on our website. And as I mentioned there as well, a lot of the format will be based on the Q&As that you would have submitted in previously to us. So as I mentioned, we have Dr. Sarah Carroll, who is the senior clinical psychologist. So I'm just going to hand you over to her initially, just for an introduction, and we'll take it from there. Thanks, Sarah.
Thanks, Lillian, and thanks so much for having me on today. I'm delighted to talk about mental health and modulators, and I was warning Emma earlier that, you know, she's going to have to manage me to stick to time on this one, because the questions that have been put forward are really interesting and really engaging questions. So myself and Paul, when we were discussing the presentation earlier, we really felt that we want this to be led by you, the participants, and you, the members of CFI. So as I said, you know, I'm very much going to be focusing on those questions that you have submitted. But just by way of background, any of those who don't know me, my name is Sarah Carroll, and I am Senior Clinical Psychologist on the CF team in Children's Health Ireland at Crumlin. And I've been working in CF for 13 years now. And as a psychologist embedded in a CF team, I can tell you that my role has changed dramatically during that time, and never more so than in the last 2 years. And, you know, considering, you know, what my role was like before, even the years before modulators came out, we were all really excited about their arrival. And I was really excited when the modulators first were rolled out. And I still am really excited about modulator therapy. And I suppose just after the rollout, or just slightly, you know, shortly after that, then there were whispers about mental health side effects. And initially, I have to confess, I was somewhat cynical. And I, in hindsight now, I think part of that was because I was so excited about them. I really, and you know, I really didn't want that to be the case. But also it was because, first of all, when they came out for adults, it was during COVID, at a time where all of our mental health was a little bit all over the place, you know. We also had, you know, other things in the pipeline, like adjustment to a new identity, you know, adjustment to, you know, perhaps seeing the CF team less frequently. And although maybe to us, we feel, oh, well, they're only too delighted. A lot of the young people I was working with at the time, that was quite a big deal, you know, and it was quite a big deal for young people. They were delighted about it, but at the same time, they were used to being the CF warrior, and it was just an adjustment and a change in their identity. So some of the initial reports of mood difficulties, we were very much attributing to that. And I still would say that that is the case a lot of the time. Other things that I was kind of thinking about were a lot of the time things like attention difficulties. if you've been very unwell with CF and you have frequent hospitalization, paying attention at school isn't going to be the number one, list of your priorities. So were some of these difficulties things that were just emerging because CF was no longer maybe the biggest concern in your life, whereas up until that point it had been. And other things I remember that we were discussing at a team, we were very aware of the anxiety that all of this was causing within the CF community. And was that as well contributing to some of the things that were being noticed and reported? So what I found a real education though over the past few years is as it's been rolled out and as more research has been done, we are getting more definitive answers around mental health and modulators, both in terms of maybe primary side effects, but also in terms of those secondary effects as well. And particularly as we go to the youngest groups now, the 2 to 5 year olds, some of the things that we're seeing are less likely to be impacted by worry about mental health side effects or by adjustment to a new CF identity. It's slightly more pure, I suppose. So that's something that I find really, really interesting and that I'm really motivated to learn more about. Now, before we get on directly to answering the questions, one of the things I'm going to do is apologise in advance for not answering some of them very definitively. But what I would add to that is that if you come across anybody who says that they can answer these questions absolutely definitively, I would be very wary of that, because this is absolutely, our knowledge around this is evolving all of the time. Some really interesting, as I said, research that's ongoing, and we don't have absolutely definitive answers, but I hope you'll find the insights beneficial and useful, and please feel free to ask questions at any time during the presentation.
Super, thanks so much, Sarah. So we'll kick off with some of the questions that were sent in to us. If you do have questions that arise throughout the session here this evening, pop them into the Q&A box there that you see at the bottom, and then hopefully we will get to each of those questions as well. If we don't, because we do have a time limit here this evening of up to 8 o'clock, we will try and get responses to those questions for you and get back to you in a scripted kind of response to some of those as well. So the first question that we have that kind of came into us was, do modulators have an impact on mental health?
Yes, I would say that modulators have both a primary impact on, or potentially have a primary impact on mental health, and potentially have a secondary impact on mental health. So in terms of the primary, that's like what we're talking about, like a really direct impact. And what I would say there is that I am convinced, yes, there are certain symptoms that can be made worse or can be caused by modulator therapies, but this would be in a minority of cases, is the first thing. The second thing I would say is that often what I've seen is that this can be transient. So this can be there for maybe a few weeks, a few months, and then the body adjusts. And that primary effect, whether it's sleep disturbance, whether it's increased agitation, that it does dissipate over time. And what I would also say is that some of these effects I've seen have been treatable as well. So yes, then I suppose then there's the secondary impact of modulator therapies, and I suppose that's something, what I'm referring to those, I would say that, and some of the questions that have come in, adjusting to potential weight gain. Another secondary impact is that, looking at maybe a much extended life expectancy. Although that seems, I think what my experience was, the teen world doing cartwheels, we were so excited, and the parents were so excited, and a lot of the teenagers that I was working with found that really irritating. They were like, no, it's just another tablet that I have to take. Maybe fewer appointments at the hospital, fewer inpatient admissions. And although that was something that they didn't enjoy, it was something that they were used to. And there have been some secondary mental health difficulties associated with that. In terms of which mental health concerns, what we've seen are in the adult population, we have seen low mood. What we're seeing more with kids is kind of more agitation. And there's a query around sort of attentional difficulties and sleep disturbances as well. But I can break that down by age group as we go through the questions as well. But I will emphasize that in Crumlin anyway, our experience has been that has been a minority, and the majority of young people have done very, very well. To give some context to that as well, I know we can say, can they cause these difficulties? I know it's absolutely no good if you're very concerned about these mental health effects. This isn't much good to you, but I also think it's a really important message to get out there that overall, if we look at the mental health of people with cystic fibrosis overall over the past 2 years, mental health has improved because of associated improvements in quality of life. So that's an important message to get out there. But do we need to be mindful? Do we need to keep an eye on the potential for mental health side effects and secondary effects? We do.
Super stuff. So what are the typical side effects of modulators that we should be looking out for?
Okay. Typical side effects then for, I suppose, the older and down to the younger. In our teenage cohort, the thing that I personally observed most was low mood, not feeling yourself. One of the things that I've been really interested in reflecting on is how certain symptoms might be interpreted differently depending on what age you are. So what we have noted with people who maybe haven't had any kind of long-lasting mental health effects, or even mental health effects in general, that they have described when they were first gone on to those first few weeks, just feeling very different. Sleep might have been disturbed, and just a kind of and I've actually had it described by one teenager in quite positive way terms, like this kind of fizz, this heightened energy. And that, if you are a toddler, might be a nightmare for parents. It could be sleep disturbance, it could be agitation. Then if you're a teenager though, or an adult, a young adult, and you're experiencing this difference in your physiology, that can cause great worry and great concern, and that can be interpreted as anxiety. But as I said, the teenagers, it's been mostly lower mood that I've seen. I've also seen as kind of more secondary impacts, some concerns, body image concerns. And then with the younger kids, it has been more agitation. But what I would say with the younger kids is what I've observed in some cases that has been prolonged, and in some cases it's been quite acute. So a period of maybe 3 weeks. And this is something that the teacher has observed, that the parent has observed, the child not necessarily be reporting, but things like increased crankiness, disturbed sleep. And one mom described her child as having just being more reactive to things that the child wouldn't normally get upset or react to, and it taking more to calm them and soothe them. But that over a period of 4 to 5 weeks then gently settled. So they're the types of things. One thing I will say generally around sleep is that sleep is, if you can fix sleep, you can sometimes fix the other things as well. Because a child who's not sleeping, an adult who's not sleeping, is going to be crankier and more agitated. So some of the crankiness and the agitation is caused by the sleep difficulty, and likewise some of the sleep difficulty can be associated with this. Because there was actually a few of them in the 12 to 18s when they came on, at the younger teenagers actually had like really bad insomnia for about a couple of weeks, which settled.
So the next question then that we have coming in is there are anecdotal reports suggesting changes in children's behaviour, for example, sleep patterns, which you mentioned there once
Yeah.
modulators have been introduced. Is that something that maybe you could talk to us a little more about?
About the sleep, is it in particular?
Yeah, just changes in behaviours and sleep in particular was highlighted.
Okay. Well, changes in behavior, yeah, as I said, mainly in the younger kids, what we're seeing is cranky. And as I said, we're not seeing it in the majority, but in the minority, there have been, it is that sort of crankiness. Just finding it a little bit more difficult to manage, as I said, one parent just saying that, child reacting more to things that they wouldn't normally react to, and a little bit more difficult to soothe, but that being quite transient.
Thanks, Sarah. I'll just pause the questions for a second because we have Paul McNally there has just joined us on the webinar. So you're very, very welcome, Paul. Thanks for
Sorry for being
joining
so
us.
late.
No, that's absolutely fine. And we've just kicked off a little bit there with some of the questions that would have been pre-submitted into ourselves. So I'll keep working through those. And then whether yourself or Sarah would like to address that, that would be fantastic then.
Great.
The next question that we have coming in was, can Kaftrio interfere or interact with typical tantrums or that ability to stay calm?
Typical tantrums and the ability to stay calm. The short answer is potentially yes, for a minority. And I suppose what's tricky is that there's a lot of things that can interfere with tantrums and a child's ability to stay calm. But as I said, what we've seen with our younger cohort has been that there has been that sort of increase in agitation. We have seen it in a minority, but we haven't seen any of them with prolonged. It has settled after a period of weeks with our younger kids. And I suppose it's our younger kids that when we're talking about tantrums more often. Thankfully, the older kids don't have too many tantrums.
Yeah, I would echo that. I think it's, and again, I'm sorry for being so delayed in arriving. You may have addressed this already, but I think it's, one of the interesting things about medicine is we're often looking for simple answers to very messy, complicated problems. And this is a messy, complicated area. We know a little bit about it, but there's an awful lot that we don't know. And I think there's rarely a simple yes or no answer for any question you might have in this area. There's a lot of if, buts, and maybes. And I think it's just really in thinking about it and talking it through and trying to get to a bit of an understanding of the way things work and what we currently know, I think is the approach. And there's slightly different takes on it. So that's why I think this kind of a forum is a really good one for it, because you get to discuss the issues out a bit and often don't arrive at a clear answer. Referencing back to what Sarah was saying, there's loads of different causes for any given behavior. And for a given behavior, there might be 6 causes. And each of them is just a little bit at any one time. And tomorrow the balance might be different again. And so this is just CF itself and medical care, and these treatments are just one of those many different factors, and they can vary from day to day even. So it's really complicated, but and it's tough for us because we know how effective these medications are.
Okay, so another question that we have that has been presented to us. How do you tell the difference between what might typically be behavior associated with a moody hormonal teenager versus the introduction of a new drug?
With great difficulty. That would be a really classic example just of what Paul is describing there. I mean, one of the things that we sort of heard when the 12 to 18s went on is this, like, oh no, this medication has turned my child into a teenager. There's an awful lot going on in adolescence, and there's a sidebar discussion about general sort of concerns about, you know, rising mental health problems in teenagers in recent years. Adolescence is a really, really complex time. In terms of telling the difference, if we're doing our detective work, what we do try to consider are things like timing. Although some of the kind of off-target effects of these medications, it's not all. We kind of initially were assuming that we would see these, you know, these mental health, if there are any mental health side effects, we'd see it kind of very shortly afterwards. And there are reasons why these effects might come down the line, but timing is important. You know, that would be one thing that we could do. I know Paul might talk to if there are significant concerns around a young person's mental health, you know, there's definitely scope for pausing modulator therapy, and we're very careful to monitor mood through that period. That will tell us something as well. But in general, it is very, very hard. And it's also the teenagers are far more susceptible than the younger kids to those things that I was discussing earlier around, you know, your identity as a CF patient, you know, the whole attitude that you might have had to your nutrition and your body image and your school, and, you know, all of these things may have changed dramatically over a short period of time, and all of these things may be contributing. So it might not even, and of course, as the, you know, insightful person who asks the questions, you know, hormones as well, but that's one of many things. But it is, I would say, if you are concerned about your teenager's mood, do talk to your CF team, do ask, you know, can they see the psychologist? Because that's what we do. We do our best to tease these things out and create a formulation. When you're working with the psychologist, you're not talking about just a single diagnosis or there's a single factor here. We're talking about a formulation and then seeing if we can address the various concerns, various concerns presented. I don't know if Paul, if you want to add to that.
Yeah, I think so. Again, it goes back to this idea that it's complicated and messy, and there's a whole load of different factors that play into any one behavior at any one point in time. And I think, you know, if you want to find out if something is involved, and remember that, you know, things are not just caused by A or caused by B or caused by C. They're probably caused by A, B, C, D, E, and F, and each of them has differing roles, and the importance of this one, the importance of B might be more than A, B, and D, but it's not that it's just a single cause. And so, like Sarah said, it's timing. So, you know, when did it start? Was there anything else going on? You try and look at all of those things first. And I think, you know, you always have to keep in mind modulators have been associated with mental health side effects. It's not the same for everybody. It's very different for different people, different ages. Week 1 of treatment might be very different to week 4 of treatment. So there's no certainties. And so after a period of time, if we think that modulators may be responsible for some mental health symptoms, and those symptoms are debilitating and serious, there's always the possibility of having a trial on, trial off. And so we would do that with any medicine that we thought had a side effect or had a beneficial effect, like, you know, asthma treatment, for example, or treatments for stomach acid. Like, there's definitely a role of trial and error. Like, try something, and if it works, that's fine. If it doesn't, you know, that's not the problem. So we will do that sometimes, but we have to be very careful about how we do that, and that it always has to be in a very, if you're doing stuff like that, you have to kind of set out your plan first about what information you're going to gather, when you're going to gather it, how you're going to decide, you know, is it the medicine? Is it something else? So rather than blindly starting and stopping or just reducing a dose or doing something, it has to be as part of a kind of a bit of detective work in a way to say, okay, well, we'll half this for 2 months, and then we'll stop it for 2 months, and then we'll start it again full dose for 2 months, and we'll keep a diary in each of those things and try and establish, you know, what's the effect of, you know, full dose, half dose, no dose. And so there's like the way of doing that is, you know, it's complex, and there's a lot of minds have to feed into that. So it's the perfect example of why multidisciplinary care is so beneficial in CF and a lot of other long-term diseases. It's because people who have different ways of thinking about it, and they're thinking about different aspects of care. And so it's really like a partnership. There's no, like, old-fashioned medicine is, I'm the doctor, you do that because that's the best thing. And then, the patient or the parent doesn't really know, and only the doctor knows, and you just have to do what the doctor says. That's nonsense. It's a kind of I have this concern, I'm a bit worried, and then the team and the parent talk together about the best way around it or to understand it. And there's nothing hidden or scientific. It's just a lot of common sense and practicality.
Perfect. How do parents recognize if there are issues within their child once they have been introduced to modulators?
Yeah. Sarah, do you want to take that?
Yeah, I mean, the thing is, we're, as Paul just said, like, we're always listening to parents, and we trust, the parents, if a parent has noticed a significant change in their child's behavior, we really welcome them to get in contact with their team, and we really take that very seriously. We take that on board. I don't think there's a definitive checklist of what behaviors you notice are associated with modulators and behaviors that you'll notice that aren't associated with modulators. I would say if there's any particular behavior that you're concerned about, talk to your team about it. But the headlines are, for younger children, is sleep disturbance, increased agitation, and in some cases, lower mood.
Mm. And I think as well that the thing you have to remember about the modulators is they work to change the function of the CFTR pump. And so the CFTR pump is one of many salt and water pumps in the cell surface that work in concert together. So when you start a new treatment like that, there's an immediate effect, and then it kind of equilibrates and kind of calms down after a while. And also there's when a medication like that starts, it often changes the way we feel. And then the body gets used to that over time. So there's definitely a bit of kind of equilibrating. So the approach, I suppose, is that we go into it with our eyes wide open, knowing that there's a potential of lots of different, side effects from these medicines. So we start them, we keep an open mind, we watch and wait. A lot of them settle, so that's fine. If there's something that's, persistent and causing trouble, well then, we start talking about that and say, well, look, could that be something that's caused by the medicine? And could it be something that we need to address? It's not even obvious that it is, because sometimes it's something else. And then we always have to think about there's the immediate change in the way that you feel, and then there's your psychological response to that. So you could become very upset about the way that you feel. So it's like, somebody explained this to me recently about why children cry when they hurt themselves. It's not because of the pain. It's because of their emotional response to the pain. They feel injured, psychologically injured, and they're emotionally upset, and that's the cause for the tears. So it's like there's an injury and there's a reaction to the injury then. So it's your psychological adjustment to what you've experienced. So I think we have to keep that in mind, especially that's not so much in toddlers. That's much more so in older people who, and sometimes, there's that famous line of a negative thought rarely disappoints. If you've convinced yourself that something is going to happen or something negative is going to happen, it often will happen. So there's that equilibration bit at the start, just getting used to it. Then there's the change in the way you feel and the response to the change in the way you feel. And all of those can be different among individuals.
Thanks, Paul. What studies of significance are currently being undertaken to evaluate the use of modulators on general mental health currently?
Well, in kids, there's two big studies that Paul will be able to talk to there. One is called Recover. I think anyone who's come to CHI has heard or met the Recover team, and there's another one, Enhance. Recover now has, for over 12s, they're doing a measure of anxiety and a measure of depression. We also have a thing called the pediatric symptom checklist. Now that's been used in Enhance as well. pediatric symptom checklist has got 3 subscales in it. So one of those is internal. Okay, so your internal is kind of the bits that, you know, your emotional experience that people can't see. So that's looking at things like mood. External is the emotions that everyone can see. That's a little more to do with children's behavior. And the third one is attention. And that's actually really a significant one that we wanted to look at, because from the older cohorts, there has been concern around things like attention, concentration, things like brain fog. And we do want to make sure that we're you know, if there are any concerns around that we're capturing them. So we're also, as part of Enhanced, looking at discrete measures of anxiety and depression. Okay, because I think that's a question that people want answered around those 2 discrete concepts or diagnoses. And we're also doing a self-report thing on cognitive symptoms. So things like memory, things like confusion, attention, and things like that as well. So that is, I mean, Paul can tell you a little bit more about it, but that's going to be from birth onwards. And we've got a control group of non-CF patients as well that we're looking at on some of those measures. And we're looking at it longitudinally over time. So before we have all the data in, we can't, but this is what we're looking at the moment. There's another, most CF parents will be familiar with TIDES, which was a 2014 study around the prevalence of anxiety and depression in young people with CF over the age of 12 and parents of people with CF. And TIDES 2.0 is now, we're looking for funding to get that done here. It's already been approved in America. And that is also looking at the pediatric symptom checklist. It's also looking at, for a smaller group of children, they'll do a more comprehensive behavioral assessment. And that we're also perhaps going to do interviews with young people, with very young children actually, and parents of younger children with cystic fibrosis, specifically on this issue around sort of their mental health experiences on modulator therapies. One thing that we've done in both Recover and Enhance as well that's been lovely is that we've done a large number of qualitative interviews. So rather than just people ticking boxes on questionnaires, we spoke to children as young as 6 about their experiences of cystic fibrosis, including the introduction of their new medicine. So I don't know, Paul, if you want to elaborate on that.
Yeah, I suppose so. One of our questions is, you know, like, how do these modulators affect, you know, psychological symptoms and mental health issues in children as they grow older? And so, I mean, more broadly in CF, I suppose the younger children born around now, or you know, who are young at the moment, generally have much milder disease. They're less sick. They're more likely to be on a modulator. And so CF in young children now growing older is very different than it was 10 years ago. And it's like a new disease in a way. And we don't really understand it, because all of the data that we collected beforehand was of, you know, the previous generation of symptoms without access to modulators, with an earlier you know, approach to CF. So there's a lot that we don't understand. So the only way we're going to be able to understand, like, what's CF, what's modulators, is to compare a big cohort of kids with CF with a big cohort of kids who don't have CF. And that's what we're doing in Enhance. We're recruiting kids with CF and kids without CF in Ireland and the UK from birth, and trying to kind of follow them along over several years and compare all these different outcome measures in kids with CF who are on modulators, kids who aren't on modulators, kids who don't have CF, to try and understand, you know, how it differs from the general population, and whether we can pick out any trends that may be related to modulators. It's a very hard one, though, because, I mean, if you take CF that isn't treated with modulators, we know that results in mental health side effects. Because you're more sick, you're attending the hospital more, you have more treatments, there's more stress at home, people are more concerned. So there's so many different nuances and little factors there that kind of feed into the psychological symptoms and mental health of kids as they grow. But the best we can do, I think, is the big cohort study to do our best to find out some information, because if we don't do that, then we'll be 5 years down the line and we still won't know anything. So I suppose it's our attempt to gather some, objective data over the next 5 years, and hopefully longer if we can get the study extended. We want to follow a cohort of kids all the way up to adulthood.
Thanks for that, Paul. Is there any research into the relationship between autism, ADHD, and modulators for children with CF?
So I would say, again, look, there's a lot of real world studies. Obviously the French real world study that people will be aware of. Our study, there's studies in the US. There's a lot of people keeping a close eye on this, and a lot of the measures that we have in place will pick up trends like that. It hasn't been the majority of the concerns, the mental health concerns around autism and ADHD per se. Sarah will talk a little bit more about that. She's more of an expert in that area. But I mean, the studies that are out there are going to pick up a link if there is one.
Yeah, I mean, there has been a reported higher prevalence of ADHD and autism in the CF population, but I've never read anything absolutely convincing me that is a primary link between CF and neurodiversity. I think that it could be, and one of the things I suppose that has been found though is that the severity of CF, so things like a lower lung function, is associated with greater dysfunction and higher prevalence of ADHD. So if there is a link, we would actually predict in a way that modulator therapy would reduce the likelihood of ADHD. At the same time, there have been, particularly in the adult population, some concerns around attention. So as Paul said, that's why we're looking at them. They will be picked up. But in terms of the prevalence generally, I think was something I might have mentioned earlier was that, I mean, if you've been frequently admitted to hospital and CF is having a hugely detrimental impact on your life, and then after modulator therapy, you're in school more, you're in hospital less, there's different concerns and priorities are going to come to the fore. So that could be one thing that's driving. If there is an increase, as I said, I've yet to be totally convinced that there is. Even children who are attending pediatric services for whatever condition are more likely to have these diagnoses as well, because because they've got lots of medical things going on. They might be missing less school or missing more school, but also they're getting ongoing assessment by health professionals. Most CF teens have a psychologist. You might be more likely to get a diagnosis in a timely manner. But it is a tricky one, yeah, and it's quite nuanced. But I hopefully we'll learn more as we collect more data.
Thanks, Sarah. Can modulators affect how children's brains actually develop?
It's a good question.
It's a really good question. I would say probably not. Paul mentioned the French study. They recently published in the Lancet, and what they've highlighted, I think they had 200 kids around that. I think roughly half of them were reported to have some. They just said standardized questionnaires. I'm not sure exactly which ones they used. And then after 3 months, that was halved again to, let's say, 25% of the original ones. But out of those, it was actually only 2 children that they were concerned about with difficulty concentrating. That's 1%. So, I would be hopeful I mean, and that's all we have, by the way. That's in terms of published studies, that's the most recent. That was published about 4 weeks ago, and we have their data from 3 months. You know, that's all we have is 3 months of data for 2 to 5 year old kids. So if anyone says that they know more about this, they're not telling the truth, because that's really the most recent information that we have. I would be hopeful that it's not the case, and I would certainly say if your child is not experiencing, you know, any difficulties, apparent difficulties in concentration, memory, or attention, I certainly wouldn't be worried that it's causing them, you know, neurological difficulty moving forward. But my hunch is no. But that's why we're collecting this data moving forward.
Yeah. I mean, I think so. We think about with any drug about on-target effects and off-target effects. So just to explain that, so the on-target effect is what it's meant to do, and so we know that the salt pumps. There's a kind of a range of different salt and water pumps on every membrane, and they all work in concert together, and CFTR is just one of them. And when it's not working, it really upsets the apple cart, and that's what causes all the organ damage that we see in CF that happens over many years. So the on-target effects of normalizing that, that can't cause damage, because that's just reverting back to a normal type or towards the normal type. So if you're seeing symptoms from the on-target effect, like I feel different, then that's just relative to ill health, and that will most likely equilibrate over time. The question is about off-target effects, and these type of drugs are small molecules, so they don't affect your genes. They don't, as far as we know, cause inflammation or the types of things that cause tissue damage that would affect the development of something. So, I mean, in medicine and in science, you always have to be totally open-minded, because you don't know what you don't know. So, and that's why we do all these real-world studies comparing kids to healthy kids to try and understand that. So we just don't know the answer to that question as of yet. I would be very surprised if there was any kind of cumulative damage, if you like, that wouldn't go away if you stopped a treatment. And I think, in this conversation, we have to kind of bring back to, one of the age-old issues with CF is that the gradual deterioration and organ damage that you see over time is very, very slow. You can't see it happening. And so it's easy for us to get caught up in what's happening in the short term, an infection today, or reduced lung function today, or, I'm better than I was last week, or whatever, and take your eye off the long-term kind of trajectory. And so one of the things as pediatricians that we think about when we think about these medicines is, can we prevent the development of bronchiectasis and liver disease and, dilated arteries and all of the manifestations of CF that ultimately become irreversible? And so that's really for us where the Holy Grail is in getting in before any of that happens, normalizing CFTR function for as long as possible so those permanent things don't happen. And so that's impossible to see, because if somebody looks healthy and appears healthy and, their LCI looks normal and, their blood tests are normal, you'd say, well, I don't know, is it just that he or she was always going to be healthy, or is the drug working, or whatever? So we'll only know from the research if we can prevent those type of things. But if we can, I mean, it's easy to forget how things used to be for people with a lifelong, abnormal CFTR function from birth. And so I think that's the balance. We always have to balance that, what we're looking at is if we can prevent from early on and really slow down any sort of, permanent organ injury, that's a lifelong investment. And then we balance that against, what's the likelihood of this causing side effects, and what's the likelihood of those side effects being as bad as the thing we're trying to prevent. So it's always a little bit of a balance of trying to understand this, and we should never take our eye off the ball and presume that something is safe or presume that it works really effectively. We should always measure it, and that's what we're trying to do in the likes of these studies, so that we can, understand and get that balance right. Knowing that, probably for each individual, it's a little bit different. So some kids have no side effects whatsoever, and then some kids have very obvious side effects. And so how you strike that balance is not the same for every person. It's different for every individual, and has to be. Again, that's the whole value of an MDT, is talking it through with the family and all the members of the MDT and trying to arrive at a consensus of what's the right thing for that individual.
And we have another question that came in there addressing the kind of side effects perspective. Is weight gain associated with modulators?
So I'll take that. Yeah. So we certainly seemed to have seen this with ivacaftor, or Kalydeco. And so the difficulty we had when we were looking at Kalydeco was it was started in people who for their whole life had been taught to eat, calories, nutrition. And so you're then introducing a drug that corrects or partially corrects the CF defect. So the absorption is suddenly better. So then that instead of all of that calories being wasted, the calorie goes on, and it's hard to change the habits of a lifetime. So some of the more recent data on Kaftrio in the younger age groups showed that it had much more modest effects on BMI when starting from a normal BMI and starting from a normal weight. But certainly in comparison, if you're taking somebody who's modulator naive and who does have cystic fibrosis disease in their bowels, and you're correcting that CFTR function, every piece of food that they eat, they get more calories from it than they did before they started on it. And so in that way, the same amount of food will create more weight gain. And so that's a question of balancing the intake versus the weight gain in the same way that we all have to do, because 1 calorie of food doesn't equal the same weight gain in every individual. It's different in every individual. So we have to, it's just something we have to keep in mind, that we have to stop with the calories, and we have to move much more towards healthy, good quality food, less processed food, more natural stuff, and a bit of balance.
I'd add to that. I agree with everything there, Paul. Definitely some of the teenagers found it really hard when they started on Kaftrio. There was weight gain, and if you're a 15-year-old girl and you've put on 6 kilos in 2 months, you're going to notice it. And one of the dilemmas that I felt I had, and I know discussing it with the dietitian, just as Paul said there, the solution is perhaps addressing your eating patterns. As we know, that is so difficult. Like, changing the way that you eat is a really difficult thing to do. But also, there were some people who didn't actually need to change the way that they were eating. They actually were eating a really healthy diet. But as Paul said, that the same diet that they were on pre-modulator was going to result in increased weight on their bones than post-modulator. And actually, the dilemma is like, well, then does the dietitian sort of give them advice on how to lose that weight? Or actually, is this just the weight that they are naturally supposed to be? And it's more of an adjustment. And that was a challenge. We did have people whose body image concerns escalated to the point of referral for eating a disorder, successfully treated. But it is that thing is that on one hand, if it's resulting in body image concerns that are related to carrying excess weight, and young people are looking to change those habits, I think it's brilliant. We discuss it as an MDT, but also some of the time it is that adjustment to this new identity, this new way of being, and actually they don't need to change what they're eating. They need to adjust to this new body image that they have.
Thanks, Sarah. final question from the pool that was submitted to us. What should parents' expectation be of the multidisciplinary care team within the hospital setting in relation to this area?
I think
I think
hopefully they would. Sorry, you go ahead, Paul.
We probably addressed this. I mean, you know, good quality MDT care is a two-way street. It's not old-fashioned, you know, the hospital knows best. What would you know? You're only a patient or a parent. It's a partnership. And so that requires that kind of two-way interaction of, well, here's a problem. Well, you know, how can you help me to, or how can we work together to try and sort out this problem? So I think like anything, this is a complicated area. It's not as simple as drug good, not taking drug bad, you know, or drug always bad, stop taking drug. You know, it's very complicated and nuanced and very individualized. And so that's the way CF is going, is that it's no longer broad strokes of, you have an exacerbation, take an antibiotic. It's like a playbook, and this is what you do. It's really kind of nuanced around the individual and, you know, how you make decisions with parents. So I think, you know, parents should expect to have a very kind of frank and partner-like interaction with the CFMDT. And in the same way, you know, the old-fashioned thing of, you know, are you taking your medicine? Says the doctor, knowing that the patients aren't, and the patient says, yeah, and nobody's being honest with each other. That kind of stuff doesn't work anymore. And so it's, you know, the kind of the barriers down and that kind of partnership type approach. So that's what both sides, I think, have to expect. And, you know, it works well when it works.
Thanks for that, Paul. That's all the questions that came in from the pre-submitted questions. We do have some in the Q&A box there. Would you like to take that one?
Yeah, I mean, hopefully we may have already answered what we're talking about in terms of, you know, how it informs research into pediatric populations. Yeah, we are looking at that. As I said, in the pediatric symptom checklist, there is a thing on attention. We're also looking particularly at, you know, self-reported cognitive symptoms. In the French study, that was parent reported. So there's three ways that we would, you know, talk about neurodevelopment. There's three ways that we would measure that. Number one is parent report. So that's what the parents have noticed. Number two is self-report. So we're trying to get that information from as young children as we can. What did they think themselves? How are they feeling? And the third way you would do it is actually by doing cognitive testing, do various tests and seeing performance on those things. And that's probably the gold standard. But what we need to do really is balance, you know, what our thirst for knowledge and what we want to know with, which is what's going to be actually doable for families. So that's really relevant in research, but it's even more relevant in terms of the, you know, the standard screening that we would do. So it's that balance. I think that what we are doing, we have introduced the pediatric symptom checklist as standard clinical practice now. So standard screening as well as in the research. I think it's very unlikely that we would be doing cognitive testing as standard clinical practice, because it's just it's a bit of an ask of the children, to be honest, and it's that balance. But I don't know if, Paul, you want to say more about that in terms of.
No, I think you've addressed that appropriately. Yeah.
Super. We have really come to time on the webinar, and we're just coming up on 8 o'clock there. There are additional questions. I can see them in the chat and in the Q&A box there that we will absolutely put to the team to address. The webinar has been recorded, so you will be able to watch the session back. It'll be posted up on our website within the next few days. You'll also receive, once you log off, just a standard questionnaire, just which, if you do have a few minutes, we'd appreciate your feedback just with regards to topics for future sessions, future webinars, which is a great opportunity for us from a content generation perspective. I want to thank everybody for joining us here this evening. From us all here at CF Ireland, we're absolutely delighted to be able to host this session for you. To Dr. Sarah Carroll and Professor Paul McNally, thank you so much for giving up your time this evening. We really do appreciate it. So to everybody, have a great evening, and hopefully we'll be in contact with you again soon, and we will get the answers to those remaining questions scripted and documented and out to anybody who might be interested.